Are you ready to live ageless? Want to discover alternative health choices, cutting-edge nutrition, and fitness for the entire family? Welcome to Highway to Health Show with your host, Dr. E, the Stem Cell Guy, where Dr. E helps you live ageless. And now, here's your host, Dr. E.
Hello, and welcome to today's episode of the Dr. E's Highway to Health Show. I'm your host, Dr. E, the Stem Cell Guy, and today I'm here with my good friend and colleague, Dr. George Zafra. Dr. Zafra is a UK-based aesthetic and anti-aging physician and vaser liposurgeon. He's medical director of Zafra Medical in Bristol, England. He has an international educational background with a master's degree in aesthetic medicine from the Universitat de Barcelona in Barcelona, Spain. He's an active member and fellow of the World Academy of Medical Science and the Royal Society of Medicine in London, England. George, welcome to the show.
Well, thank you very much for inviting me, Dr. E. I'm really happy to be part of the first episode of your show, and I'm really looking forward to being invited for many more. So please carry on. Let me know what I can be of help today.
Absolutely. It's a great pleasure to have you. And I'm sure that, all of our listeners are also going to be able to get a lot of very valuable information from you and your expertise. Speaking of which, how long have you been doing aesthetic medicine?
I would say that I've been actually doing this since I began medicine, like studying as a bachelor, because it's always been my interest. So every time, when we're learning biochemistry, when we're learning surgery, when anything, I was always looking to ways to improve, my future patients. If I ever finished medicine when I was a bachelor, how to do something for them in the aesthetic side without going into, something fake, without being, offering something unrealistic. So I would say since 2000, when we started uni. Yeah.
Wow, that's quite a bit, huh? Now that you mentioned it, we've known each other
yeah, so
2 decades, huh? That's closing in on 2 decades. Great. So tell me something. You just
close
mentioned
to 20 years. Yeah.
Absolutely, yeah. You just mentioned something that's interesting, and I'm sure in the minds of a lot of our listeners. And there seem to be two camps: the people who are very interested and they don't care about looking, fake or looking plastic with, in plastic surgery and all these different things. And there seems to be a large population of people, large group of people who thoroughly dislike that. It's not that they don't want to look better or improve their looks. It's just that they're so turned off by this fake look that they simply don't move forward, don't change anything in their appearance. And from what you're saying is, you've been working and you've been helping a lot of these women and men, of course, to improve their looks. Is this correct?
Yes, that is totally correct. I think since I've managed to finish the master's degree in aesthetic medicine, my main focus was to offer patients, men and women, a realistic approach to obtain a natural beauty. So I think that is kind of like part of our motto of the clinic, which I will be telling you as we go on. But the thing here, and now society is a bit too, let's say, overwhelmed by social media, celebrities, actors, actress, and they want to look like this one or that one. And the approach that there is in the US and the approach that you have, for example, in France and Spain or in the UK is very different. So what patients want in each of the countries is very different. So I've been fortunate to, practice in various countries and seen what patients want in each one of them. And it does change quite a lot. I'm sure that you'll see that in the States, that it's, quite different than what you might expect from Europe.
Yeah. So what do you think? What would you think, or what would you say is probably the most important difference of what a patient would seek or would be interested in here stateside in terms of cosmetic and appearance improving, and in the UK?
Well, in the UK and the US, actually, the UK follows US trends. So it will be more of Europe that will be following different trends compared to the US and the UK. So I've been speaking with colleagues of mine that, that also are currently, practicing in the States and also back here in the UK and Europe. And they were telling me of how patients in the US, let's say their approach is a bit more over the top sense, like we can talk about lips, and the lips are, big, they're like very in your face. They're like, yeah, you know what? I have money, so I'm gonna, put 2, 3, 4 mils of demo filler in my lips, and look like, and it'll show. Whether in, for example, France, Spain, it will be more subtle approach. I want to look natural. I want to look, better, or as I was when I was younger, but not fake. And that is kind of like what I also try to share in my social media. And my social media, we kind of like focus on. We do use the example of celebrities, but I use the example of celebrities that have aged naturally, beautifully. Probably they have had some enhancements, but they still look natural in their own way. So that's what I like to promote. So when I have patients asking me for something very, let's say, ridiculous, and I'm very blunt, and I tell them, this is ridiculous. You tell me, so you want like that? And I'm like, I'm sorry, but I don't do that, because I don't want for you to be walking the street and saying, Dr. Zafra did this. And I'm like, no. It's like, no, this is. So I try to walk them through a more natural approach to their beauty. And I think, well, actually, not. I don't think, it's like most of them, have gone. It's like more than 95%, accept that guidance, because I think we are a tool. We have the knowledge, we have the expertise. So we are a tool, that more patients can use to achieve their goals. And that's, I think, what we should be, guidance, to help them achieve that, not let's say a service provider that, they come to you and they ask for, I want to look like this, and you do it. No, you should also have your say in, that's why I think that's what we studied for, to give them that guidance and that level of, proper medical treatment.
Absolutely. Yeah, I completely agree with you. I think this is a very interesting point that you make in terms of us as physicians, as doctors, to have to be, or we should be, not have to, but we should be the guide for many of these patients. And that's the thing that we see lacking a lot of times. Either we have the doctors that are very commanding and like, this is the way that you have to do these things, and they don't explain, they don't share, they don't elaborate on that. Or you have the other ones that, like you're saying, that they will just go ahead and do whatever the patient requests, whether it is what's most convenient for them or not. And I think this is a very important distinction.
I think that's been a bit of the reason that I have that kind of like approaches, because in my, besides being an aesthetic physician, I'm also a GP, a general practitioner, a family doctor, as might be called in the States. So obviously, I've been giving consultations in general practice, for years. And so, you are dealing there with diabetes, with cardiovascular diseases, with elderly patients, with kids, with everything. So you are listening to them, you are looking into a wider spectrum of the whole human, let's say, aging process, and, the illnesses that you come about. So when that patient comes to me for aesthetic treatments, that is the only thing I do now. I do focus on the whole person, and I think that's what some other colleagues of ours, might be losing out, because maybe their approach is purely, aesthetic. So they lose on getting to know their patients into what is the real reason of that improvement. So listening to the patients, understanding what they want, you will get better results. They will be happy. You will be happy. So it has to be, let's say, we're going to fall into that word that, now it's been used a bit too much and too loosely, the holistic approach of medicine, and they always ask for that. Oh, but at least here in Europe, they're always like, oh, are you looking into the biopsychosocial side of the patient? Well, you should in aesthetic medicine, because it is a huge part of it.
Can you break it down for listeners? What is this biopsychosocial um, approach? Because I'm sure that most of our patients, once you break it down, they will say like, oh yeah, that sounds like the kind of doctor that I want to go to. But unless we break it down, many of them might not understand it.
Yeah, well, as a GP, as a general practitioner, and as a doctor here, when you are going through your studies and specialty, you have to understand the patient, that the patient is not only the illness, not only the anatomy, not only the physiology. That will be, the biological side of the patient. You're not only that, you also have the social part, because the individual also interacts in a social environment, and that social environment will affect their health. And then the psychological, how they're with their biological, with their social, their psychological health is also important. Now, mental health is so important, and how, assessment of body dysmorphic disorder before having any treatment is so important. um, you have to have a ground knowledge, to understand a patient's, psychological state before, committing to, um, you know, giving any procedures to any patients, or to guide them in a way to say, what, maybe you don't need this treatment because you need this other help. And that is a part, that as doctors we have to take really, really serious, and remember that we have that, even despite if it's, a botulinum toxin injection or a dermal filler injection, we still have to, care for the overall health of our patients.
Absolutely, yeah. That is so important. When I started my career as well, and before going into regenerative medicine, they spent a few years, as you well know, and some of our listeners might know, and doing a lot of cosmetic procedures as well. And that is definitely something that is so important for you to mention and for you to spend time on, because it's incredibly valuable to your patients. And that's the difference between going to somebody whose job is just to inject, a dermal filler or a botulinum toxin or any of these different products, and going to a doctor for these things, because a doctor will at least in theory, supposed to be looking at all these different aspects, and might help a patient discern whether they actually require that treatment or not, and whether it's the right approach or not. So that's incredibly valuable, and it brings me on to another thing that I definitely wanted to ask you. Now that you're saying that you focus on your patients as a whole person and not just as a face, for instance, that you're going to treat, or that you're going to get rid of a couple of lines or wrinkles, what else are you doing with your patients other than the treatments themselves? I know that you do a couple of things both before and after. So what are these different areas that you focus on when your patients see you?
Yeah, well, we do. It's like, when it comes to the door, you kind of like, always people find us through social media. That I would say that we post less than 10% of what we do. It's very little what we post, and that is, there's a reason, because the only things I post will be from patients, real patients of mine. We don't use any stock photography that a lot of companies will provide to different, with, for anybody that do certain treatments with stock photography, so that they can help them out with their, you know, with their marketing over their social media. I don't. These are all patients of mine, so therefore, consent for the befores and afters is fully obtained, and they're actually happy, and they actually will share them on their own, and they will say, here it is, I want to go on it, I'm really happy to do it, but I will never ask for that. it's usually it comes from my patients, and respecting their privacy, respecting that, is so important, because I know some patients that have actually left other practitioners because they said, I went to somebody else, and even if it's a lip, that you don't have any recognizable feature there, because they might have used it, and that they felt that it was a violation of their privacy, which is
Absolutely.
something that I will never, do, and I will always protect really, really deeply. So when they come in, they have a idea of what they want, and I'm like, okay, so tell me, what would you like? And yeah, the common ones will be, get rid of some wrinkles, maybe some lips, maybe a little, they want this or that, done really on the face. Usually it's face. And then I'm like, okay, so when we finish, okay, so this is what you want. I will never tell them, okay, this is, you also have this, you should also get that. Only if they ask me, you know, is there anything else? I'm like, well, tell me. The most important thing is for me to know.
So what do you ask your patients?
Usually I will ask them, is there anything that's bothering you that you think that can be improved?
Okay.
And that's when, they will just, elaborate, it can be something as simple as a little mole, that, they might have 10 moles on the face, and I might be seeing, directly one that's central facial. And I'm thinking, okay, this one should go, but no, it might be a very tiny little one that's in, let's say, in the corner of the cheek where, barely seen, but that's the one that's bothering them.
Gotcha.
And I'll say, would you be happy if that goes? Yes. Well, okay, that's the one that's gonna go. That goes, and they're happy. So, you have to listen to your patient. You have to ask them what they want. What will they be happy with? And that will give you the, a result. Because what you want, what we, I would think you agree with me, is that you want your patients to be happy, with you, with your treatment, and if they need something else, to come back. And if they're happy with that, to tell your friends,
Absolutely. Yeah,
their
well,
friends.
that's the whole point of it. Back in the day, doctors used to normally get their patients that way. It was cool, it's word of mouth, and and it was because patients were happy and satisfied, so that they would say, "Listen, you know what? You have to go see this doctor." And it seems like today, especially here in the US, many of these doctors have become what, or have had to turn to what we call checkbox medicine, where they're growingly increasingly spending less and less time with their patients because they have so many other things to do in terms of charting and filling out paperwork, that they simply don't have time to continue with their patients. And it's no wonder that we're seeing a lot more and more dissatisfied patients, people who feel like they go into a doctor's office for whatever the reason, and they feel like they weren't listened to. They feel like they weren't, that there wasn't enough attention paid to them. They felt, even a lot of times, just another number that arrived at the office, because they it feels so cold and impersonal. And I think that regardless of what area, what specialty, what field in medicine, healthcare in general, that you're focused on, I think it's very, very important to really keep that in mind, that we're dealing with people, and patients are the one kind of client that does not want to be a client. Nobody goes to a doctor's office because they want to. They go to a doctor's office because they need to. So it's very important to have that emphasis and to empathize with them. And I think you're doing a great job by recognizing that, and that making sure that the rest of your staff knows that. So I do want to recognize you for that, and it's incredibly valuable. Hopefully, a lot more doctors will start adopting this, and it's going to become more and more mainstream in medicine. So before we move on to something else, I also did want to ask you, I'm sure that you get this question a lot from your patients, especially women patients. What else can I do to really get the most out of my treatments? What creams can I do? What should I do every day? So if you were to give a one or two or a couple of actionable takeaways for our listeners during this episode in terms of improving and maintaining their looks, their skin, their health in general, what would those be?
Well, the main one, that is a very, very good question, because usually, after you explain the treatment, you said, okay, this and that. They always ask, and what cream should I use? And I'm like, no creams. I am not. I will. I don't recommend any particular brands. I don't have any conflict of interest with any brand at all. And that is also another thing that we don't share on social media. We don't advertise any brand, and I will not do it on a consultation. We don't sell it. Well, we don't sell any cosmeceuticals either. That's also something that we don't do. But I can guide you into what they should do. And the only thing I ask them is the only thing and the main thing you should do is a sunscreen. And I give a lecture about the impact of the sun on the skin and vitamin D, because it's something that people forget about. But here in the latitude that we are, we have the angle of which the sun hits the earth will impact of the absorption of the UV rays, and how this correlates to production of vitamin D, but also into how your skin ages. So the main factor for skin aging is the sun, and it's called photoaging. So if you want to do something, and the main thing you can do to help your skin is a sunscreen. And the sunscreen is not the one that comes in your makeup, I tell them, because usually the makeup has a 15 SPF. So I'm like, that is nothing, so forget about that one. You have to use a 50.
50, 50.
50, yes, 50, not 30s. No, it has to be a 50. And that comes from I've been reading dermatology recommendations from Brazil, and they recommend 50. It has to do with the amount of sun exposures they are there. They have to do it. They don't need any supplement with vitamin D, because the amount of sun they will get will be enough that despite they using SPF 50, they will still convert, and they will still have vitamin D enough. That is not the case in the UK, in Europe. Everybody needs vitamin D. But talking about creams, sunscreen. That's what they have to use. Sunscreen, SPF 50 every day. Yes, every day. And people will apply it in the morning, but forget to reapply. If you want to have a proper effect or protection, you have to reapply. And the reapplication, depending on what you're doing, if you're in the sea or you're not, and if you're washing it or there, it's about every 2 hours.
Wow, every 2 hours. So what do women do? I mean, they're wearing makeup because obviously they do the sunscreen and then they do their makeup on top of the sunscreen. So even if it's light makeup, what is your recommendation? Do they wipe the whole thing off and they reapply makeup and sunscreen?
That's where it gets a bit tricky for them, because obviously, ladies, they use a moisturizing cream, then they apply the sunscreen, and on top of that, they apply the foundation, and on top of that, they apply maybe some blushing things, or like. But then what happens? Those different layers will not blend together
Okay.
most of the times. And then a lot of my patients will say, but then if I apply the sunscreen, then when I apply my foundation, it rolls. My recommendation is find a sunscreen. Yeah, that's a 50 that has tint. So it has a foundation. So if you can find a tinted sunscreen that has foundation, it's a good moisturizer, that will be the ideal for you. Here in the UK and in Europe, there is a brand that has those three factors in it. So I just say, the best thing you can do is forget about the expensive creams. Expensive creams, the only thing they have is perfume, and it has a nice packaging, and you'll have the little box, thing. You can put it in your night table, and it'll look nice, and then you can put it on, smell it, and say, oh my god, yeah, this is 80 pounds, and it does wonders. Yeah, after a month you see that there's nothing changed, and yeah, it's doing nothing. Well, forget about expensive creams. Find a sunscreen that works for you. The ideal would be tinted, and it's a good moisturizer, and it'll do wonders. So I don't know if you can say brands or anything.
Yeah, sure, of course. If you have a preferred brand, I don't sell any of those, and you are just said that you don't sell any of those, so sure.
No, I don't tell any of those. And actually, what I tell my patients, like, oh, and can I buy some, doctor? I'm like, well, no, I'm like, I don't sell them. I should maybe because I always recommend them, but I don't. I just don't like. I don't. I wasn't. I didn't try to sell creams. I recommend creams, but this one. So this one's called Heliocare. It's from a Spanish brand. Really, really good. They made their own block. It's made out of fern, so it's actually a bit more natural. It's a chemical sunscreen. When I say chemical, there's physical and there's chemical types of sunscreens. So this is a chemical type of sunscreen. It works really well. All types of skins. I personally use it. It comes in different tints. It comes in a brown, in a light, and in a sun-kissed version. For more of darker skin tones, there's a brown one, and it's not gonna make you brown. Really, it blends in really well with your skin. So believe me, they'll love it, and it's cheap.
Perfect. Well, what I'm going to do is I'm going to go online, I'm going to look it up, and I'm going to see if it is available stateside, and I'll put it in the show notes. I'll add this. I'll add some other links of things that we've discussed. So far you mentioned that sunscreen is very important, but you also mentioned something about moisturizer. And I do know as well, one thing that is very important that very few of us actually do, and it's to wash your face. A lot of people, you go in the shower and whatnot, and you wash maybe a little bit. But a lot of us, if you shower in the morning and then you go to bed, and women at least they take their makeup off. But for a lot of men, we don't even do that. You just go straight into bed, and everything that your face has been exposed to throughout the day is it's just caked there, and you just take it to bed with you. So do you have any recommendations there?
Oh yeah, I mean definitely. Washing your face at night, it is basic. It's like I would say it's basic skincare. In the morning is put your sunscreen, moisturize it, you know, and then don't touch it. Do not touch your face. That is something I also remind my patients. Don't touch your face. You are touching things that people, hundreds of people might have touched, whether if you travel on public transport or you're in an office, and all that bacteria will eventually get in your face. Yeah, you don't want that on your face. So do not touch your face. Leave your face alone, and then in the after, don't wash it too much. Also, that is something important. There are some people that tend to, go a bit over the top on washing the face. You can or exfoliate their face, you know, their skin too much. So do not be getting peels or microdermabrasions that often. On a daily basis, you just have to sunscreen in the morning, don't touch your face, and in the evening, wash your face. Because yes, as you mentioned, you have all these dirt and grime that that's the pollution that's in the air. Everything, all of that settles in your skin, clogs up your pores. That will trigger a response that your pores will say, well, I need to breathe, and they'll open up more, and all those toxins will go inside you. So you don't want that. So yes, you must wash your face.
Perfect. Well, there you go. That's your actionable step. I mean, it doesn't get any simpler than this. You just heard a doctor specialized in cosmetic medicine saying, "Don't go spend your money on very expensive brands because all you're buying is perfume, and you're getting this feeling of improvement when in reality you're just applying a bunch of different chemicals and things." What should you do for everyday skincare? Remember, wash your face, use a moisturizer, stop touching your face every day, and wear sunscreen, at least SPF 50. I'm going to make sure to follow up with Dr. George and get the specific names of the brands that he recommends. He's obviously in the UK, as most of you heard. But I'm going to see if those same brands are available stateside, and if not, maybe he and I we can look at different alternatives to suggest for everyone else that's listening. George, before we wrap up for this episode, where can people find more about you?
where everybody finds everything. It's on the web. You'll find us on our website. If you go directly on our website, uh, zaframedical.co.uk. There you'll have the links to our mailing list if you want to join in. It's usually focused on our local patients, but you'll find also information that's might be helpful to you, because we always try to make some, give some tips health wise, as what you can do, like we were talking about today. Social media, as I said, it's very, very focused on, a bit motivational. People that have, started having, aging well. We also give some tips about health, and you also do see some befores and afters. Not that many, but yeah, you will see them. And yeah, so you can follow this there. It's quite easy to find me. That will be on Dr. Zafra. That if you click it all together, you'll find me. And if it's the clinic, you want to find Zafra Medical, and you'll find this. Yeah.
You cut off a little bit. It's Dr. Zafra, DoctorZafra, and that's on what, social media?
Yeah, that's on social media. That will be my personal one, and then you have the clinic one. That will be Zafra Medical.
Perfect. Well, I'll make sure to have links to all of those in the show notes. Everyone, please make sure you go and follow Dr. Zafra. Like he said, there's one thing that they do in his clinic that I really like, and they share celebrities that we all know, and they share how many of them have actually aged in a way that they call gracefully and beautifully. And like he said at the beginning, I'm sure that many of them have had certain enhancements, but none of them look fake. And if you look at the befores and afters, and some of them are 25 years ago, 20 years ago, and you can see obviously how they've aged, but you also see that they don't seem to have aged the way that the everyday person does. And what we're doing is we're bringing all those secrets over here to you, and we're delivering them to you. Make sure to follow Dr. Zafra at his different social media profiles and ping him directly. Ask him a couple of questions. He's a great guy, not because I've known him for a long time, but I can tell you this. And make sure that you sign up for his newsletter so that you can learn something more. They're constantly, not every day. You're not going to get bombarded or anything like that. But you will get a couple of tips, a couple of different treatments that they're currently doing. And obviously they can weigh in on what's available here stateside if you're not in the UK, or if you're not even near Bristol and can go visit him. So make sure that you go ahead and do that. And if you have questions for this episode, make sure to visit dre.show. That's DRE.show/ask. Or just look and click on the appropriate button, and you'll find a way to send your questions about this or any of the other episodes, and I'll make sure to address them in future episodes. So once again, George, thank you so much for joining us. It's been a great, great pleasure. Any parting words that you'd like to say to our audience?
I would just like to thank you for inviting me. It's been a pleasure and really enjoyable. It's like talk about, some basics about aesthetic medicine, without going into treatments. And I just want to remind everybody that, that everything you see on social media, take it with a pinch of salt. But remember that it is achievable. It is achievable. We have great results. It is a combination of treatments. It will never be one treatment that will deliver all the magic. All the magic is done with an appropriate consultation and the ideal treatment selected for you. So it will not be the machine. It will not be the product. Be the knowledge that will make that magic work.
All right. Well, thank you so much for joining us on the show. Thank you, everyone, for tuning in, and I'll catch you in our next episode. Have a great day.
Thank you for listening to Dr. E's Highway to Health show, helping you learn the science of living ageless. Did you enjoy the show? Please like, share, and subscribe where you listen to podcasts. Dr. E wants to hear from you. Go to DRE.show. Again, that's DRE.show. Until next time, this is Dr. E's Highway to Health, helping you live ageless.